Hi, I'm Dr. Astruc, and I'm a psychiatrist in private practice in Saratoga Springs, New York. And today I want to present to you some information on bipolar type 2. There's three things I want to cover. Number one, what is it? Number two, how is it different from bipolar type 1? And the last thing are common misdiagnoses or common illnesses that are initially diagnosed as one thing that ultimately turned out to be bipolar type 2. Now, if you want more information, I'm setting up an information site, bipolar2helpblog.com. That's bipolar 2, Roman numeral II, so that's bipolar II helpblog.com. You can visit me there, and if you give me your email address, I'll keep you up to date with any new information that I have coming out on bipolar type 2. So first off, what is bipolar type 2? The overview, the big picture, is that it is one of a number of different illnesses that are characterized as mood disorders. And mood disorders then have two subcategories in psychiatry. There's depressive disorders or unipolar depression. Those are people who just have depression. And bipolar disorder, those are people who have ups and downs. Bipolar 1 is the bipolar disorder that most people think of when we talk about bipolar disorder. And bipolar 1 is characterized by highs that are so high they interfere with your functioning. They're relatively easy to pick up. People get very fast in their speech, they don't sleep much, they lose their judgment, they get very impulsive, very grandiose. Lots of big ideas circulating through their heads, and by definition it has a negative impact on their ability to function in day-to-day life. Now, bipolar 2 looks very different than that, and it's hard for people sometimes to wrap their heads around the fact that we're calling it almost the same thing. Bipolar 2 has highs that are very low grade, and by definition these highs do not cause any problems in your ability to function. So these are periods of times when you feel better than usual, have more energy than usual, and are often more productive than usual. I have yet to have a patient come in and tell me that they're having a problem with getting too much done and they're feeling better than usual and they want some help with that. Bipolar 2's problem is not the highs. Remember, we're saying by definition, no problem. The problem with bipolar 2 is that the bulk of the illness is really depression, and what you end up seeing is a lot of cyclical depression or cycles of depression with these low-grade ups that can be sort of hard to see. If I pulled in 100 people in here and I said, are there days that you feel better than usual, better than most other days? Does that ever happen to you? Most people are going to say, yep. So the up part is important in terms of making a diagnosis, but in terms of causing problems, it's not a problem. Now, the most common misdiagnosis for bipolar 2 then is going to be depression, because that's what people are coming in for. These depressions are crushing, they're paralyzing. It takes great effort to get out of bed, to get off the couch, to point yourself at the shower in the morning. Everything is hard. So with bipolar 2, what we end up seeing are cycles of depression with these low-grade ups, which are often the catch-up time. Everything you couldn't do while you were depressed, wham, you knock it all out when you get the hypo-mania going. Now, I plan to put out more information on bipolar type 2. Please visit the website bipolar2helpblog.com. I'll be putting out more information, and hope to see you there. Give me your name and email address, and I'll let you know as we get more stuff going. Thanks very much.